Hello, welcome to this edition of Schoharie County Newsmakers. I'm Sean Kingsbury, and today I'm joined by Asante Ship-Hiltz, who is the Public Health Director for the Schoharie County Department of Health. Along with Asante, we have Valerie Manchester here, who is a public health nurse, and Brenda Hewitt, who is the Public Health Sanitarian. Welcome, everybody.
Thank you for having us.
Yes, thanks for being here today. What we're going to talk about today is, in general, a little overview of what the Schoharie Department of Health does for Schoharie County. So Asante, if we could just start off by, you are the director, I believe is your title?
That's correct.
What does that entail?
As the Public Health Director for Schoharie County, I focus on overseeing our public health programs and our prevention programs. And within the department, we have a nursing division, which includes our maternal and child health services. We also have a communicable disease program that oversees all of our sexually transmitted diseases as well as other communicable diseases. We also have an early intervention and preschool program as well as an environmental program, and we have an environmental health program.
That's a lot of things that the Department of Health does, that's for sure. Let's go over to Valerie. You're a public health nurse, correct?
Yes.
That's your title? Can you talk a little bit about what that entails?
It's the nursing programs from the health department, which is the maternal child health program, the lead program, the immunization program, car seat program, and the communicable disease program.
Okay. And Brenda, you are a public health sanitarian. That's a fairly fancy title. Can you expand on what that covers?
I'm one of 3 sanitarians in our department. Our department is environmental, and what we do is try to provide the county with a healthy, clean, and safe environment. The different programs that we operate are restaurants, food service establishments, temporary residents such as your hotels and motels, mobile home parks, children's summer camps, public swimming facilities, all public water. We also do the weights and measures department. We work with emergency preparedness, the adolescent tobacco use prevention program, and also in conjunction with the nursing unit, we work with the rabies and lead program.
Sounds like a very busy department within the county. April starts National Public Health Week, Asante. It seems like something that you're having some focus on. One of the reasons you're with us today in the studio is to talk about that. Can you expand on what National Public Health Week means to you and to Schoharie County?
Yes. So since 1995, the first full week in April has been designated as National Public Health Week. And that is an opportunity for us to highlight what our local health department does and what are some public health promotion activities being conducted in our county. So what we want to do is utilize your TV show as well as some other media sources to let the community know that we are here to serve you and that you can come and access any program or any service that we have.
Okay. As part of our show today, we have several public service announcements that we're going to be airing during the show. When we get to one of those subjects, what we will do is we'll talk about that area that is covered, and then you've got some pretty nifty PSAs that have been filmed. Can you talk specifically about the emergency preparedness one, just so when we get to that, people will understand how that's a little different? I believe that's something you guys were involved in yourselves.
Absolutely. With National Public Health Week, what we want to do is roll out a emergency preparedness media campaign, and that's our opportunity to share with community members what they can do to prepare for a disaster. As you know, back in 2011, our county was devastated by Hurricane Irene, and we want to ensure that going forward, the health department can contribute to some education for community members to know what they can do in advance to prepare for that. And the video clip that you'll see with this PSA talks about how you can get an emergency preparedness kit prepared in advance and how you can create a plan with your family. And that PSA will be aired throughout National Public Health Week as well as the next few months, and you'll see it on a few of the Schoharie County Department of Transportation buses, and you'll see a few billboards throughout the county that highlight what you can do to prepare yourself for an emergency.
Okay. Well, actually, let's take a look at that now, because that does sound very interesting. So let's take a look at the emergency preparedness public service announcement that you guys produced.
Blanket?
Check.
Water?
Check.
Food?
Check.
First aid kit?
Check.
Meeting place? Meeting place.
The Schoharie County Department of Health wants to remind you to always be prepared. Got an emergency plan? You should. Take steps to keep your family safe. For a complete emergency checklist, go to SchoharieCounty-NY.gov. Get a kit, make a plan, and be informed. Always be prepared.
Flashlight?
Check.
Brought to you by the Schoharie County Department of Health and this station.
Okay, we're back. With the emergency preparedness sounds like a new focus for you, at least from people normally when you think about the Department of Health wouldn't necessarily think about emergency preparedness. Is that something new that you've taken over, or has that always been one of the responsibilities of the department?
We've actually started a medical reserve corps, and that happened back in 2008. And that's an opportunity for our health department to reach out to community members who want to be involved during a disaster. And of course, a disaster doesn't come every day. So in the meantime, what we do is we have these volunteers in the community. They come and they join our MRC, Medical Reserve Corps, as a part of the Emergency Preparedness Promotion. And then they support the health department with clinics, with other prevention activities throughout the year so that they can be prepared as volunteers to know what to do and know how to organize during an actual disaster.
Okay. Valerie, if we can talk a little bit about your position as a public health nurse. You talked about some of your responsibilities. Can you expand a little bit on some of the main focuses that you have going on at being a public health nurse for the county?
One of the focuses is the lead program. We encourage testing of children at age 1 and 2 and all pregnant women that may be at risk. We also provide monthly clinics at the Schoharie County Community Action Program through their WIC office, and anyone can call and make an appointment. It's a finger stick lead test for the child at age 1 or 2. We follow up on elevated lead levels in the county, provide education. We have an environmental staff, sanitarian, that can go out and make a home visit to identify any lead paint issues or any areas that are probably prone to cause high lead levels.
No, is that still an ongoing problem? The problem with lead levels, and is it older homes mainly?
Yeah, older homes, and especially after the post-flood, a lot of renovations that were being done on the flood, in those homes that were flooded in the Schoharie Valley.
I assume the flood changed a lot of your positions in a lot of ways and added a lot of responsibilities or made your job a little tougher. I know, Asante, you said you were flooded out too, correct? Your office was flooded?
Our health department lost our office. So we did relocate during the flood. We have a new home now, which is back in the county building on Main Street in Schoharie, but instead of being on the first floor, we are now on the 3rd floor.
And another part of being a public health nurse, obviously, talked about vaccinations a little bit. What is the role of the county health department when it comes to vaccinations?
We participate in the Vaccine for Children's program, which is from birth through age 18, and it's for children that are uninsured or receive Medicaid or are underinsured, and it's all the childhood vaccinations we provide. We also do seasonal flu clinics in the fall at outreach areas throughout the county. We also encourage our children to go to the medical home. We promote that for vaccinations.
And Asante, as part of the program as well, you have a public service announcement that talks about vaccination.
Yes.
Where does that come from?
It comes from the Center for Disease Control and Prevention, and the CDC allows us to utilize these public service announcements to get information out to the community about what you can do to be safe and which immunizations are important for your health.
Okay, let's take a look at that right now. We've got a public service announcement dealing with vaccinations.
What you are about to see today are true crimes of disease. Disease that can affect any adult. Disease that can be found in your neighborhood. How can you protect yourself? Find out more about these diseases. Take our first example, influenza, nickname the flu. Sounds not too bad, but causes tens of thousands of deaths every year and 250,000 hospitalizations, most in seniors. The flu can prey on anyone, even someone like Carol Johnson. Carol has clearly taken time for her health today, but we also know that she got her yearly flu vaccine. It protects her all season and can keep her from spreading it to her new grandniece. Influenza. Successfully case closed. Looks like that one's down. But there are some sly diseases that you may never have even heard of. Like the sneaky pneumococcus. Funny word, deadly disease. Most folks don't know that it causes thousands of deaths every year and tens of thousands of serious cases. We're talking about some truly bad bacteria, ones that can invade your blood, your lungs, or even your spine, causing septicemia, pneumonia, or even meningitis. Meet Curtis Leone. Does he even know that these bacteria can cause diseases severe enough to take him out of the game permanently? Curtis got his pneumococcal shot. Another deadly disease, foiled. If you thought that was a funny name, this one's really no laughing matter. Herpes zoster. It causes the painful shingles disease. Shingles isn't about your roof. This disease can affect your nervous system, your eyes, or even other organs, causing severe pain for weeks or even months. Anne Marie Oliver appears here to be taking care of herself. But does she know that her risk of shingles over her lifetime is 1 in 3? Amazing! It looks like Anne Marie's doctor already recommended the shingles vaccine, and she's protected. In fact, she convinced her sister and husband to get protected too. Vaccine protection in action keeps her on the move. Shingles disease, case closed in its tracks. Finally, we have to look at one more case, the missing Tdap vaccine. It sounds like a dance. The Tdap. But tetanus, diphtheria, and pertussis are serious diseases that can be prevented. What Bill Akers doesn't know is that he can bring home pertussis to his new grandchild. Pertussis is a bad cough for grown-ups, but a serious killer infection for babies. Could Bill have prevented bringing this home to his grandchild? What I meant was, Bill Akers was careful to make sure he was up to date on his Tdap shot. His doctor helped protect not only him, but his new granddaughter too. There you have it. Another case of prevention in action. Stopping serious diseases before they start is what the Vaccine Scene investigation is all about. Vaccines aren't just for kids. Ask your doctor about what vaccines are right to protect you against serious diseases.
A message from the U.S. Department of Health and Human Services and the Centers for Disease Control and Prevention, CDC.
Okay, and we're back. Let's move on to some of your responsibilities. I know we were talking about, you mentioned rabies vaccination or rabies clinics. Can you expand a little bit on what the frequency and how often those are held? And again, it's something that you wouldn't think necessarily from the Department of Health, but I guess preventing the spread of rabies would be a focus of yours.
Yes, we offer free rabies vaccination clinics to anyone and everyone that wants to bring their family pets, which are dogs, cats, and ferrets. We actually have the dates. We got them today set up for our next clinics are going to be in May. Each one is held on a Wednesday evening from 6 to 8 p.m. May 1st at the Sharon Town Highway Garage, May 15th at the Schoharie School Bus Garage, and May 22nd at the Cobleskill Fairgrounds.
And do you have to be a resident of the county to participate?
No, you don't. We won't turn anyone away.
Okay. And is there a cost?
No cost, free.
So certainly no reason not to get your pets vaccinated, that's for sure. You also mentioned weights and measures as being part of your position there. Can you talk a little bit more for, I know especially, I'm not sure what that entails. So what does weights and measures entail?
What we do is we ensure that every measuring scale in the county is accurate. There's all different scales from your gas pump stations to a deli scale, your pharmacy scales, anything that has a weight that people purchase something by, we go out and make sure that it's accurate.
And that can cost people a lot of money, I assume, too, if scales aren't accurate or if a pump isn't pumping what it's supposed to be at the gas station. Mm-hmm. So it sounds like a pretty large responsibility. How often is something like that checked?
Every year.
And so far in Schoharie County is that you check things every year. What happens if there is a violation with that?
We order that they don't use the device, and they have to either have it corrected or removed from the facility. And then if they have it corrected, then we go out and retest to verify that it's accurate.
Sounds like an important function of the department. Another function that's under the umbrella of your section is restaurant inspections, you mentioned. I assume there's a lot. It doesn't just include restaurants, but you said other places that serve food. Can you kind of expand on that? How often do those get inspected, and how do people get access to that information if there has been an inspection that maybe didn't go well?
We go out to, almost every facility has an annual inspection. Higher risk ones that cook a wider variety of foods will have more inspections each year. We do all the restaurants, all your hot dog carts, your mobile units at fairs, any restaurant that's at a motel and hotel. All of our inspections are now posted on, if you go to our website, the Schoharie County Department of Health's website, we have a little icon on the home page with a little spoon and fork, and you can click on that, and it'll bring you up to a page, and you would put in Schoharie County, and it'll pull up all the current inspections for each facility.
And Asante, you had mentioned when we talked previously about that's kind of a change in access that you've started there, is people having access to these inspections. Can you talk a little bit about that?
Yes, we would like people to be informed about where they go to eat and understand that we are transparent. So if they want information about what was found at a restaurant, they can do that. And it also allows us to highlight the restaurants that didn't have any violations. They're doing very well. You can also go and see us brag about those restaurants.
So it helps support restaurants that are doing the right thing, but also if there has been an issue, at least the information is out there so people can make an informed decision.
Absolutely.
Let's go back to the public health and nursing umbrella a little bit. You have a car seat event coming up. And I think it's very important. I know from personal experience, I drove around for almost 6 months with a car seat that was not installed properly. And I went to one of these events and saw how difficult it is to actually install a car seat properly. Can you talk a little bit about the event that's coming up?
Yes, we hold a monthly event the fourth Wednesday of every month at 1 o'clock at the health department. It's for parents-to-be, grandparents. It's an educational event, so we show a video, it's like 20 minutes, and then we can also go out to the car and look at the way the car seat has been installed or provide a car seat for someone that's income eligible.
It's a great program.
Probably about 80% of the car seats are not installed correctly.
I know the event I went to had a trooper that was helping, and took almost an hour for them to be able to get the car seat installed correctly. And it's kind of scary when you think about that there are so many misinstalled car seats out there that, if you do get, unfortunately, in an accident, it can't do its job properly because the car seat isn't installed. Asante mentioned you also do a lot of prevention work as well. And one of the public service announcements that Asante mentioned was dealing with sodium and high blood pressure. Can you talk a little bit about that?
We encourage people to call our office if they have any questions regarding hypertension, sodium. We can refer them to the correct organizations. So a lot of preventative information we provide.
Okay, and is this another public service announcement from the CDC that we'll be seeing?
Yes, it is.
Okay, so let's take a look at that. We've got a public service announcement about sodium.
Fact: Americans consume too much sodium. Sodium raises blood pressure and puts you at risk for heart disease or stroke. What's too much? Most people consume more than 3,400 milligrams a day, but less than 2,300 is recommended. Even less for others. A lot of sodium is hidden in processed foods, not the salt shaker. A regular sandwich can have over 1,500 milligrams of sodium. Guess what? Add a can of soup and you're over the limit. Here's what you can do. Buy fresh, frozen, or no salt added canned vegetables and eat more fruit. Use fresh poultry, fish, and other lean meats. Use low or reduced sodium items and limit sauces and mixes. Choose wisely when eating out. Restaurant food can be high in sodium. Ask for low sodium options. Most importantly, learn to read nutrition facts labels. Less sodium, better health.
We're back. Let's go on. Asante, if you can talk a little bit about, it's called the iCondom program, and a lot of local businesses participate, also some offices. That is a program that I think probably most of our viewers haven't heard about or is maybe something new. Can you talk a little bit about that program?
Sure. iCondom is very new. It was actually originally sponsored by MTV. And it's a program that, through our department, allows us to give away free condoms, male condoms, female condoms, for anyone in the community who wants to access them. We know that it's a great preventative measure, and we want to prevent the spread of sexually transmitted diseases and HIV. And the wonderful nurses that we have in our department, Valerie, has accessed these free condoms, and she's also distributed them to some local businesses in our community so that people can go to those business establishments and access the condoms. They don't necessarily have to come to our department. The other great thing about the program is that it is an app on the iPhone. So anyone can go onto the App Store on their iPhone and download iCondom, and then on that app they can see where they can go to get free condoms. So listed on there currently is a few businesses, including ourselves. And Valerie, you want to just talk about which businesses those are?
We have a hairdresser in Schoharie, Jay Lacey, and there's one in Cobleskill Barbershop. I think it's Kevin's Barbershop. So.
And you said there is an app, and being a new program, are you looking for more participants to come on board, either different offices or what other type of businesses would normally participate in something like this?
Our goal is to reach out to any business establishment that wants to be a part of our program, because we want to make sure that people can get access to free condoms if they need them. And they don't have to be limited to going to their doctor or coming to the health department, but they can go anywhere. So one of our main priorities for the health department is to collaborate, not just with the traditional means of collaboration, like community service organization, but also small businesses who are out there, like bars, hairdressers, tattoo parlors, places where people will frequent, and the condoms will be available to them.
Okay. And we have a public service announcement for that as well. Is that from the CDC or from another?
This is specifically from MTV,
okay.
And it promotes iCondom, and it instructs you on how you can use your iPhone to be able to take part in this great initiative.
Okay, so let's take a look at the PSA from MTV for the iCondom program.
MTV's staying alive, and iCondom are getting it on. iCondom is a free iPhone app that lets you locate your nearest condom outlet. We need your help to locate and rate every condom outlet in the world. Step 1, download the free iCondom app. Step 2, upload your nearest condom outlet and let us know any useful details. Step 3, well, what you do next is down to you.
Okay, and we're back. Let's talk a little bit about one of the other pretty big topics I think that you cover is municipal water systems, and I think that would be in your purview. How many municipal water systems are there in the county?
There are 10 municipal water systems, which are your village waters. Mm-hmm. Then we have 70 plus, which are public water, which are all any public facility that's on a well water.
Okay. And what do you, so your office kind of looks over those, do you test the water from those facilities, and how often do you do that?
We test it, and the facility themselves test it also. Okay. Each type is on a different treatment and testing schedules. The main testing for a public water is for total coliform bacteria, which is a main indicator for E. coli in a water.
And after the flood, I assume there may have been some damage or I'm sure it made your job a little more difficult, and we'll kind of look at that for each one of you as well. But the flooding with the municipal water systems, was there damage done? Was there things you had to watch out for from the flooding?
We had a couple systems that were inundated, and they had to go onto a boil water order. So it was a bit of a challenge. We had to go out and hand out pamphlets and go door to door and tell people not to drink the water until we could determine if it was safe again.
And Valerie, can you talk a little bit about, from your perspective, because the flood is still such an overarching issue for this area, even though we're quite a ways past it now. From your area of expertise within the department, how did the flooding affect you?
For immunizations, we did provide about 1,400 doses of tetanus, diphtheria, and pertussis vaccination to our county residents, which is a phenomenal amount of vaccines, and we accessed nurses from Serve New York to provide assistance because there was only 2 other nurses in the department at the time. So, it was stress more immunization, the monitoring of the lead levels in children in the Schoharie Valley, communicable disease because of the effect on the water system.
So I'm sure that the flood did seem to connect in a lot with what you do, Asante, in your department. Is it made things worse in some respects. Like you're saying, it affected lead levels, a lot of tetanus shots being given out, the local water systems. I mean, can you kind of expand on some? I know you lost your office. I mean, pretty difficult time there. Were there any other direct flooding effects that happened to your department?
Sure. We lost our medical records, obviously. So what our department has done moving forward is to do as much electronic medical record as possible in terms of scanning and making sure that everything is electronic, accessible, online, and we are not totally relying on just hard copies anymore.
And that, I guess, leads back to, as we wrap it up here, emergency preparedness again. Your new PSA that we showed, obviously that was an emergency. So going forward, you talked a little bit about it, but just as we end up here, as a focus for the County Department of Health, where do you see this going forward with emergency preparedness? I know you were talking about some kits that people can have, generally planning in case, unfortunately, let's hope not, something like that happens again.
Right now, our main focus is to get as many volunteers as a part of our Serve New York data pool as possible. Just like Valerie mentioned, during the flooding, our staff is not huge. We only had 2 nurses at the time, so the Serve New York volunteers were able to come and assist that effort to vaccinate over 1,400 people. So that was phenomenal. So anyone can be a volunteer with us. They do not have to have a medical background. All help is wanted. They can go onto our website and they can sign up on the tab that says Volunteer Now, and they can be an extension of our department by doing that.
Okay. And just for the end here, can you give out that website and a phone number where people can reach you?
Sure. Our phone number is 518-295-8365, and they can call us for any of the emergency preparedness, for any questions or services that they're interested in. Brenda mentioned the water systems. We don't regulate private wells, but if someone has questions, we do provide technical assistance. We do have a maternal and child health home visiting program through nursing. So if you're a new mom or pregnant and you want some assistance, we can do that. So if you go on to the main Schoharie County website, you can access the Public Health Department and you can see all of those services, and we're available to serve you.
Okay. Well, I'd like to thank Asante, Valerie, and Brenda for being with us here today. Thanks for watching this edition of Schoharie County Newsmakers, and we'll see you next time.